The anatomical position is very important for us. It's a reference of how a person is standing when they're facing you with their feet forward, arms down at their side, palms forward, and face forward. And therefore, this over here is a picture of the anatomical position. So even if your patient is contorted like somebody, Situation, sorry, I don't know how to spell. But even if your patient is contorted like somebody in a circus, you would have to examine them and think about their body in the anatomical position. Therefore, if I ever say something to you, I will be referencing the anatomical position as well. There are also some directions that we use in reference to this position. Some of the easier ones that students know is that anything that is higher up on the standing position of the body is called superior. This basically means up. There's also inferior, because every anatomical position direction kind of has an opposite, and this means down. There is also anterior, which means front, and I'm going to show you that on this picture over here on the left of someone on the side. And there is posterior, or posterior, depending on where you're from, and this means back. We are not done. If something is more toward the midline of the body, we would call it medial. If something is more toward the outside of the body, whether on the left or on the right, we would call it lateral. But we would also have to classify lateral. We would say that something over here is right lateral. And I know some of you are like, wait a minute, but that's on my left. Yeah, it's on your left, but it's the patient's right hand. So that would be our patient's right lateral. Over here, this would be our patient's left lateral position. There's also something that I kind of can't show you here, but there's something that is superficial, is something that is on the outside. So for example, skin is superficial, and so this means to the outside. You might know some people that are superficial. There's also deep, and deep means to the inside. So all of your squishy organs are deep to your superficial skin. Okay, there is also proximal and distal. And students sometimes have problems with proximal and distal. They will think that proximal and distal actually means superior and inferior, or they'll think that proximal and distal means medial and lateral. It doesn't. Proximal and distal are terms that we reserve for the limbs of the body, right? Because the limbs of the body have areas that are close to the midline and areas that are far away from the attachment point, right? So the elbow here is proximal. It is more near the attachment point of the shoulder. The wrist, the hand, are distal because they are further away than the attachment point. The knee is proximal because it is closer to the hip. The ankle is distal because it is further away from the hip. So it's all about the attachment point with these terms proximal and distal. I also wanted to point out that when we get into nervous tissue, we tend to call the front of the body ventral, and we tend to call the back of the body dorsal. We use these when referring to the nervous system, like the brain and the spinal cord. I teach classes that involve four-legged animals, like this one here that's smiling with the tail. And what's interesting with four-legged animals is that their anterior and posterior are the front and the back, just like us. However, four-legged animals actually have a back that is called dorsal and a belly that is called ventral. And this is where we get the dorsal and ventral because we are bipedal and standing up. dorsal and ventral are synonymous with anterior and posterior. For a four-legged animal that is not bipedal, not standing up, dorsal and ventral are very different than anterior and posterior. Regional terms are something that you come to understand as you study A&P. I don't require you to memorize these, but what's a good thing to do is maybe every once in a while you come back to this slide and you see how many of these terms are familiar to you. So right now you might be able to say that nasal, I know what that means, right? Ocular, I know what that means. Pelvic, umbilical, abdominal, mammary, you may know what those mean. Pubic, but femoral, inguinal, you may not know. Pollex, antebrachial, antecubital, you may not know those. So it's a good idea to come back to this picture and cross out or highlight the things that become more and more ingrained in you. As you'll find when we progress to Bio 172 or Anatomy and Physiology 2, many of these words will be stuck into your vocabulary. This semester we get to know muscles and bones, and this will turn you on to words like olecranon, buccal, brachial, tarsal, right? So it will open up your vocabulary to more of these kind of in the background as we go along. So again, it's always worthwhile to revisit Chapter 1 and make sure that you are progressing in your understanding.